everyone. We are from Hong Kong and Shenzhen Tianyou Medical Research Institute. It's my great honor to be here on behalf of Dr. Shen Weixi to present our work entitled Precision Diagnosis and Treatment of Infectious Disease by Combining TCM Manifestation and Cytokine Syndrome Pattern of MM. MM here refers to modern medicine. Modern medicine has recognized cytokine storm is the basic mechanisms and mechanisms development, progress, and evolution, and the manifestation of disease. But modern medicine cannot distinguish and master the feature of cytokine storm. And modern medicine has good efficacy in treating most of the disease, but have not, with poor efficacy in treating the dysfunctional disease, for example, pulmonary fibrosis, liver cirrhosis, SARS and COVID-19, etc. And our research and achievement demonstrate a great significance in solving this scientific problem for modern medicine. There are two medical theories in China. TCM refers to traditional medicine, and MM refers to modern medicine. The mainstream, MM is the mainstream and recognized as medicine in the world. But the natural science theory follows a monism approach. That is, there should be only one ultimate theory of medicine without differentiate Western medicine or Chinese medicine. MM here refers to correlated to the Western medicine. It excels in recognizing and treating the disease structurally. On the other hand, TCM refers to the Chinese medicine, always used as a functional perspective to understand and treat the human disease. Comprehensive medicine should include structural medicine and functional medicine. Here shows the difference between structural medicine and functional medicine. Structural medicine is objective, and it emphasizes the genetic alternations and organ structural changes. It is a long-term pattern, and so it is more easily to be detected. On the other hand, functional medicine is highly dynamic and comprehensive, so it is more difficult to be detected. It emphasizes the biochemical functions, physiological functions, and it is integrated terms. But what is the medical principle of TCM treatment? The clinical practice indicates TCM treatments and compound Chinese medicine have great efficacy in treating the disease. But until now, there is no lacking the scientific principles to support the TCM treatment. And vast of the financial resources have been used in this research field in China. But however, after 60 years hard research and accumulated of vast of experimental data, the medical community has been unable to break through in this research field. The modern medicine still can understand the principle of TCM treatment. 60 years hard research, but there's no breakthrough. Why? Because it is lacking of a medical theorist. He must be proficient in TCM and MM area, and he must be think independently to track the secrets hidden in the vast of experimental data to clarify the medical principle underlying TCM treatments and compound Chinese medicine. At the end, to develop a new comprehensive medical theory through integrating both TCM and MM. Dr. Shen has his medical degree, doctor degree in Peking Union Medical College, and he did his doctoral dissertation on the research of TCM treatment from 1996 to 1999. And we think And we think to link TCM syndrome to the thinking mode of modern medicine. So first question is, what is TCM syndrome? TCM syndrome, the term zheng in TCM refers to a pattern or a syndrome. And it is comprehensive and the presentation of signs, symptoms, disease conditions. So it's more personalized. And TCM treats the disease based on the syndrome differentiation. In other words, TCM treats the disease based on zheng differentiation. We took the fibrosis, for example, tuberculosis, pulmonary tuberculosis always have the following symptoms, such as weight loss, low fever in the afternoon, heat feeling in the hands and feet, etc. So all the symptoms refers to the yin deficiency syndrome in the TCM. So we have the theory innovation of that. The pathogenesis of TCM syndrome are the results of this equivalent status of cytokine network, also known as cytokine storm. And the bias of TCM syndrome represent different changing patterns of the cytokine storm. We took yin deficiency and qi deficiency syndrome for examples. The pathogenesis of yin deficiency is a syndrome due to the increased activity of IL-1 and TNF-alpha. On the other hand, the pathogenesis of qi deficiency is due to the increased activity of TGF-beta. So we propose the medical principle underlying TCM treatment is due to the is to regulate the cytokine storm and to achieve the therapeutic effect. So these are our published paper in the Chinese medical medicine. And we also have widely reported by our findings in the Chinese social media. And in the 2019, the COVID-19 outbreak. And so these are our anti-COVID-19 time course. After the outbreak of COVID-19, we propose the cytokine storm caused by the increased activity of TGF-beta. And then we publish in the next year. And in the 2022, the outbreak of COVID-19 in China mainland, we showed great efficacy in great efficacy in treating the patient with COVID-19. And we propose the original medical achievement. The first is to identify and distinguish the features of cytokine storm based on the manifestation of the disease. Second is to establish a precise diagnosis and treatment model for infectious disease based on the manifestation of the patient. So these achievements show great significance in treating the COVID-19. There are two thinking modes of recognizing disease in medicine. The traditional one is the virus infects our body, and then we have the immune reactions, and at least resulting in different kinds of symptoms. For example, fatigue, fever, anemia, etc. But we propose a reverse thinking way, is that we base on the manifestation of the patient to deduce the cytokine feature. So it is more practical and easier when we treating the patient. And here we publish our finding. And in 2020, we also get widely reported in the social media. And in the next year, we published in the Frontiers. And at the same time, we found the specific medicine for COVID-19 in the same year. And here shows the central role of TGF-beta in the process of the disease. The increase of TGF-beta activity will lead to the endogenesis pyrogens and result in fever. So we can find a fever is a common symptom in the patient. And most importantly, increased TGF-beta activity also leads to the mitochondrial dysfunction and sodium, potassium, ATPase dysfunction, and result in the fatigue is most typically a symptom in the COVID-19 patient. On the other hand, TGF-beta inhibits the proliferation and differentiation of the lymphocytes and leads to the immune suppression. And clinically, the COVID-19 patient divided into three types. And the first is the critical type, medium type, and mild type. But how to the symptoms or the manifestation at different times is not because of the amount of the virus that infect our body, is right. No matter how many virus, how much virus then infect our body, it will not lead to the different subtype of the patients. But the TGF-beta activity is played a key role in the different subtype of the patients. If the TGF-beta is a mild increase, so it will lead to no or mild symptom in the patient, so it is a mild type. If the TGF-beta activity increase in medium increase, so it will lead to the fatigue, fever, and etc. It's called ordinary type. And the third type is TGF-beta activity increase critically, so it will lead to more severe symptoms. For example, ARDS or pneumonia. So it is defined as the critical type. And we also widely reported by the medium. So in the 2022, the outbreak in China mainland, we use our method to treat the patients suffering from acute COVID-19 infections and its complications with the compound Chinese medicine and with our specific medicine, and it shows great efficacy in treating the patients. Here shows the 3 steps that the virus infect our body. The first step is the viral infect our body, and the second step is the immune reactions and cytokine storm. And the third step is the manifestation, shows maybe a tissue damage, ARDS, fatigue, fever, etc. Typically, the modern medicine use the medicine targeting the first step. It means it is targeting the rival invasion or replication. But our specific medicine is targeting the second step of this process. And here shows some cases of COVID-19. The first one is a 96-year-old lady. So she suffered from the high temperature and poor mental state. But after taking the Huoxiang Zhengqi water and our specific medicine, and her temperature the symptom was disappeared after 6 hours taking the drugs. And this is a 46-year-old young gentleman, and he suffered from the complications of COVID-19. For example, he suffered from more than a month body obviously afraid of cold, palpitations and dyspnea, and often requires oxygen inhalation. But after taking the specific medicine for 2 days, the virus symptoms significantly relieved and disappeared. And the third case is a 30-year-old female lady, and she also suffered from the obvious complications of the disease, such as chest tightness and shortness of breath, and it gets worse during these days. So after taking the specific medicine for twice a day, all the symptoms alleviate and disappear. So this shows the great significance of our treatments have in the basic medicine and clinical medicine and pharmacology and the related industries. It is significance first in the TCM area, TCM field, modern medical field, and the diagnosis and treatment method field. And our finding points out the medical principle underlying TCM treatment. And also it will deepen our understanding of the disease, the development and the progression of the disease. And another great significance of our finding is that we attribute to the cytokine storm. And modern research indicate that the viral infectious disease damage the human body through cytokine storm. However, modern medicine struggle to distinguish the characteristics of the cytokine storm in different disease or patients. And the figure shows the complexity of the cytokine, of the interaction of the cytokine and the lymphocytes. But none of the predominant molecules or predominant pathway can be figured out at this time. And based on the cytokine theory, several neutralized antibody was used in the clinic. For example, IL-1, IL-6, and TNF-alpha neutralized antibody was used in the COVID-19 case, but none of them show good efficacy in treating the disease. What we finding may have attribution to the GCP standard as the establishing because we base on the manifestation of Zheng and to include the patient. It is more easier and more practical when we're doing the clinical trial. So this finding enables the WHO and governments to develop a scientific response based on the manifestation in outbreak of infectious disease now and in the future. And here we declare, we establish a novel model to distinguish cytokine storm feature based on manifestation of the disease, and it makes that personalized treatments for the infectious disease and dysfunctional disease probable. And we propose cytokine storm feature of TGF-beta activity is the central role in the COVID-19. And we found a specific medicine for COVID-19 targeting the pathophysiological process and a rapid decision-making when outbreak of the infectious disease worldwide. But unfortunately, current international medical community has not yet to comprehend the novel medical theory, limiting its applications in clinical diagnosis and treatment. So we hope to collaborate with the insight scholars and worldwide to make our medical research and novel theory into practice. Thank you.